Hello and thank you for joining us today. We're here to discuss the gendered experiences of mesothelioma study, which was conducted in 2019. We call it the GEMS because it's easier to say. And the study aimed to explore the experiences of men and women living with mesothelioma. So mesothelioma is a rare type of cancer caused by asbestos, and our aim was to establish with participants how services could be made more accessible and how services should be best delivered to be acceptable for both men and women. So my name is Stephanie Ejegi-Memeh and I'm a research associate at the Mesothelioma UK Research Centre. I worked on this project alongside my colleagues Dr. Michaela Senik and Beth Taylor, and we were led by Dr. Steve Robertson and Professor Angela Todd. So today I'm delighted to be joined by Mavis Nye, Helen Childs, Liz Darlison and Lynn Squibb. So if you would like to introduce yourselves one by one, would you like to begin, Mavis?
So I'm Mavis Nye. I've got mesothelioma and I've had it for nearly 13 years now. It's only because I have had clinical trials that I am here today.
Lovely. Thank you for being here, Mavis. Helen?
Hi, I'm Helen Childs and I'm a solicitor, and I consider myself so lucky to be able to specialise in the area of asbestos-related claims and predominantly mesothelioma. It's a true community of support groups, healthcare professionals and charities, and we're really lucky to be able to work in this area.
Lovely. Thank you for being here today. Lynn?
I'm Lynn Squibb and I co-founded HASAG, Asbestos Disease Support, 15 years ago after I lost my own father to mesothelioma. And we have a thriving support group now that operates throughout the south of England.
Perfect. Thank you for being here. And Liz?
Hi everybody. First of all, thank you for asking me to be part of this panel. It's a real privilege. My name's Liz Darlison and I'm a consultant nurse. I work at the University Hospitals of Leicester, but I'm also one of the founder members and also the chief executive of Mesothelioma UK, a national charity for the disease. Thank you.
Thank you, all four of you, for giving up your time today. You're possibly some of the busiest people I know, so thank you for coming. We're really grateful to have you here on this panel. So as part of the study, we interviewed 11 women and 13 men on their experiences of mesothelioma. We also analysed data provided to us by HASAG, so we'd like to give special thanks to Molly Squibb, who processed the data for us, and without her efforts we wouldn't have been able, to generate the fantastic findings that we have. So thank you, Molly. So at the Mesothelioma UK Research Centre, we're dedicated to not only conducting high quality research that reflects real lived experiences of patients and their family members, but also making sure that the research that we conduct gets out there into the community, into hospitals, into clinic rooms, and improves lives of people living with mesothelioma. So with this in mind, we've developed various outputs aimed at different audiences to make sure that our findings from the GEMS reach different audiences. So this includes a report, 2 academic papers, and we've presented at various national and international academic and community conferences. You can find out more about our activities on our website.
In the UK, over 2,500 people per year are diagnosed with mesothelioma. Exposure to asbestos is responsible for around 9 out of 10 mesothelioma cases. Mesothelioma is more common in men than in women, and nearly half of the people diagnosed with the disease are over 75 years old. The complexities of these gender differences, such as initial symptom development, experience of the diagnoses, occupational risk, and the extent to which patients seek legal advice and receive compensation are less well understood. It's crucial for legal professionals, healthcare practitioners, and organisations that work with mesothelioma patients to understand these complexities and ensure that individuals get the support that they need. Research from the University of Sheffield, funded by Mesothelioma UK, has explored gender differences among people with mesothelioma in relation to time from symptom onset to diagnosis, seeking legal advice and receiving compensation, and occupational risk. The experienced research team have pioneered the use of a large national data set and qualitative interviews to explore these complexities for the first time. Firstly, the research found that occupational risks were multifaceted. Exposure to asbestos at work was not only due to direct handling, but also indirect exposure like office blocks or schools. This broadens the range of occupations to be considered as high risk, from traditional occupations such as construction workers, usually associated with men, through to office workers and teachers, more commonly associated with women. As a result, when exploring potential mesothelioma risk, detailed occupational histories must be taken of patients by experienced professionals to consider a broader spectrum of direct and indirect risk. This links into the second key finding of the research. Diagnosis and subsequent care pathways varied across genders. It took longer for women to be diagnosed than men, and communication of the illness and risk between patients and healthcare professionals were influenced by gendered norms. Healthcare professionals need to consider a wider index of suspicion across occupations with direct and indirect exposure to asbestos to avoid gendered diagnoses and speed up diagnosis times. Equally, information provided to patients needs to be presented clearly and be sensitive to the needs and the priorities of the patient. Finally, the research found that women are less likely to seek benefits and compensation as a result of their condition, and if they do decide to begin this legal process, it takes longer than men to receive that compensation. This is impacted by gendered differences in family and social expectations. Relevant professionals need to improve information available to female claimants and signpost the help open to them. For more information on gendered differences in experiences of mesothelioma, read the report here. Reflect on your practice and consider how you could support patients more effectively, or refer patients to the Mesothelioma UK website and national helpline.
So throughout the animation, we really tried to raise awareness of the number of people living with mesothelioma in the UK and the impact that mesothelioma has on the lives of those living with it. So my first question to you all is, do you think there needs to be more awareness of mesothelioma? And if so, how can we do this? How can we generate that awareness?
I think we're trying so very, very hard with Meso UK and Action Meso. We're trying hard to raise awareness, but you can never raise enough, can you? Because there's always new people with being diagnosed, and so there's always new awareness needed.
Yeah, thank you, Mavis.
I think it's always difficult to try and find an angle to promote mesothelioma. All of us here for many, many years have been trying to raise awareness of the dangers of asbestos and people diagnosed with mesothelioma. And it's really difficult to get the prominence that other lung or other cancer types have. So we all work really hard to try and achieve that.
Thank you. Liz?
Yeah, so I you know, it's not an easy public health disaster to raise awareness about, if I'm honest. And as Lynn said, we've been trying for a long, long time. I think if suddenly tomorrow 2,000 people should lose their life in our country because they were exposed to a deadly substance, there would be headlines across the world, and there would be headlines for many months and possibly years to come. So it always beggars belief to me that this goes under the radar until it comes knocking on your door. And when your family are affected, or when you have worries or concerns about it, then people start to prick up their ears and listen. But yeah, absolutely. There needs to be more awareness until we change the current status quo in terms of people being exposed, and while we're still exposing people every single day to asbestos, then we need to continue to beat the drum about how deadly asbestos is, and really about, what mesothelioma is and the realities of what can happen through very casual exposure, just a few fibres. So absolutely, yes, definitely we need to continue to raise awareness.
Thank you, Liz. Helen?
Yes, from my point of view, when clients first get in touch with us, so many of them have never heard of mesothelioma, and so many families were really unaware of the dangers. As you've said in the report, some of the men who've worked in heavy occupational exposures regarded the diagnosis with an asbestos-related illness as sort of inevitable. But you've highlighted as well how unaware women are of the dangers of even transient exposure to asbestos, and how much less likely they are to be that they've been aware that they've been exposed. So I completely agree that awareness of mesothelioma is crucial. It's difficult to know what more any of the people around this virtual table could do, because all of the charities and Mavis are just absolutely driven to raise awareness. So I can't suggest how, but I agree it's crucial.
Well, I'd like to say that even in just the few years that I've been working in this field, I feel like there have been huge strides actually in awareness. Like I think the work that you do does make a difference. Maybe because you all do it day in, day out, you don't see the difference. The small, tiny increments that make up kind of increased awareness happen. But I think there's been a lot of progress even in the short few years I've been around. So yeah, I think it's getting there slowly but surely. Sorry?
I'd agree, Steph. I totally agree with you. There have been huge strides forward, and I think one of the things you and the team, the research team, should be congratulated for is really making those strides, because anecdote and it is not enough. And through generating evidence like this through the GEM study, that's one way that we can raise awareness in a more rigorous way, perhaps, because we can put some rigorous research methods behind that anecdote, that those of us that work in the community and are part of that community, things that Mavis and Lynn and Helen and I know, because we're doing it day in and day out, but we're actually to have good quality evidence to put it out there really is. So more research will definitely help with that raising awareness.
I think it's about partnership working as well though. Sorry, Mavis.
I was going to say, and using social media. Now, that really is the biggest tool we've got. And that raises awareness.
Yeah.
We can raise awareness.
Using all of the threads to kind of weave together our work is kind of what gets awareness. Okay, I think we could have talked about that just for the whole session, actually. It's really interesting. So our research found that occupational risk may not be as straightforward as we previously thought. And one of the issues is that mesothelioma can develop up to 50 years after contact with asbestos. And as well as developing mesothelioma from direct handling of asbestos, working in environments where asbestos is present, like hospitals, schools, office buildings, was also a risk factor, particularly for women. So how can we improve the ways that professionals ask questions about occupational exposure to asbestos? I don't know if you wanted to start, Lynn.
I think it's about the questions that are asked during the investigation. So if somebody presents with, say, a pleural effusion or a persistent cough, it's trying to move away from asking the question, did you work with asbestos? Because things have changed so much over the 15 years that I've worked in this area. When I first started, there were a lot of laggers. electricians, plumbers, people that worked in heavy industry, and it was predominantly men that we went to see to support. But over the years, far more women are diagnosed. And they can't say that they worked with asbestos. You have to delve into their work history, their lives, even back to when they were at school. So I think it's about the questions that are asked to patients during the investigation. Change, the type of questioning. Do you think you may have been in contact with asbestos? What did your partner do? What type of industry did you work in? Those types of questions, especially school teachers. We know that over 80% of our state schools still contain asbestos. So it's all down to questioning as far as I can see it.
Thank you.
So many people don't know where they got contaminated, do they? And now they're bringing it out of the buildings. It's becoming airborne. So there's going to be a lot of people not knowing where they've been contaminated.
Yeah, it's scary.
I think, this may be a little bit provocative, Steph, I don't know. But I just increasingly think, why, as a clinical person, so doctors, nurses, why should it make any difference what their occupation is to us? Mesothelioma is out there enough. We see it enough in our hospitals that we should just have it in there amongst our differentials, irrespective of what somebody has done for a living. And we should leave all of the occupational kind of history taking to experts like Lynn and Helen, because it clinically doesn't make any difference what somebody's done for a living. It doesn't matter to me whether somebody's been a joiner or a lagger or a teacher. It doesn't have any bearing on their treatment. And I just think, we have the highest incidence of asbestos diseases in the world, in our country. We don't ask, I don't know, people with melanoma, we don't ask them, have you used sunbeds or laid in the sun excessively before we consider it might be melanoma. We look at the clinical picture and make the diagnosis. So although, it's not as easy with meso, granted, but I just, it is a bit provocative perhaps, because we look for clues to pointers and leaders to a diagnosis, and, occupation with some diseases, occupational diseases particularly, can help. But, increasingly, I just think asbestos is everywhere in our society. Let's assume everybody's been exposed, and let the actual history taking be carried out by experts like Lynn and Helen.
Wow.
I agree with that. I do agree. Sorry, Mavis. I do agree with that. But I think sometimes the patients that go to the GP, it's difficult to get past the GP for the referral in the first place, because they'll assume that they have a chest infection, and especially women find it difficult to get that referral in the first place. And from previous studies, I know you did the patient audit a few years ago, Liz, that it was women that went to the doctor way more than men did, to get that referral to the hospital, so that they could have further tests.
I wonder if it's also because the way that peritoneal mesothelioma presents can be really quite subtle and different. And it's much more likely to be a woman that's got peritoneal mesothelioma than a man. I just think that there are lots of other diagnoses that are higher up the chain of suspicion for women than for men. And I just think greater awareness amongst healthcare professionals that it is so prevalent, because although you're Meso UK and the nurses are amazing, there are still areas where it's really not treated in the way the brilliant way that you treat it. And as far as the legal side of things is concerned, it's so important that you've got a specialist dealing with the potential claim, because they'll approach it hopefully in a way that's open-minded about where the exposure might have occurred, and also in a really thorough way so that nothing is missed. And an example of that is the talc, the asbestos contamination in talc can give rise to a potential claim in the States. And I don't think that's really on a lot of law firms' radar if they're not dealing with these type of claims day in, day out. So it's just specialist advice is crucial, I think.
Yeah. Thank you. So it kind of links on quite nicely. So we found that it took longer for women to be diagnosed with mesothelioma than men. So how can we work on reducing that gap? I know we've already started to talk about some of the ways.
I guess in the ways that we've said, you know, I think raising awareness and I think, you know, helping people to become more aware that asbestos is everywhere and nobody is spared the risk of asbestos-related diseases, particularly mesothelioma, that can, you know, occur after very low levels of exposure. So I think, and raising awareness amongst the GPs, as Lynn has pointed out, you know, they are the gatekeepers for that second level of care and getting investigations. And, you know, but most GPs will probably only see one case, if that, of mesothelioma in their working practice probably. So it is really hard. But I think blanket asbestos awareness across the country that has the highest incidence and the biggest kind of public health problem due to asbestos, raising the awareness across the board will have to reach then the GPs and people in primary care, practice nurses and so on.
I do feel that the GPs should be made more aware. My GP said to me that he was, his specialist was diabetes. And so when I walked in with numbing arms and he told me I had a trapped ulnar nerve, he said, you just threw me. He said, I didn't know, honestly didn't know, and I never thought of asbestos at that point. And so, you know, that they need to be made more aware that asbestos is in our society and that it is causing problems.
Okay. Does anybody else want to come in on that question? That we've already spoken about quite a few of the reasons. So going back to the animation, are there any parts of the animation that are particularly significant for you, either in a personal or professional capacity? What stood out for you?
I think the whole thing stood out. I think it's just great to be able to sit there and watch and take it in and become, you know, be made aware of the problems.
Yeah, I'd agree. I think, you know, it's such a great media for great way to get messages across. And I think the study, the findings from the study resonate with me in every aspect. And I just think it's a great way to get those messages across.
Yeah.
I think people are far more inclined to sit and watch that than listening to a speaker sometimes. It's so much easier to get that message across in the animation than any other way that we've tried to do, I think, previously.
Yeah, I agree. I think it's great and it's really engaging. And it was the layout of it and the design of it was just really bright and clear, and I shouldn't say fun, but it drew you in, didn't it? It made it so very interesting, even for people who've got no idea about mesothelioma at all.
Fantastic. Glad to hear that. So how can the study findings be used to improve the care that men and women living with mesothelioma receive? And I mean care in the broader sense, not just hospital care.
I suppose it's important to appreciate the differences, isn't it, between how men and women assimilate the information that they've been given. Because for women, it wasn't on their radar at all when they went to the doctors. Your report really illustrates that they needed a lot more information at an earlier stage. And also, I was a little bit surprised that there was some reluctance to engage in some of the support groups, and that you drew that out with one of your interviews, because they are so amazing, the care and support that's given by support groups and charities. It would be lovely to find other ways to reach out. And I wonder if, because this research was done before COVID, I wonder if the fact that these support groups have now been increasingly, they went virtual, and some of the virtual support groups are going to be maintained. I wonder if that will enable more people to participate, because it can be a little bit daunting going and walking into a room full of strangers, and it's easier to do it virtually, I think. So hopefully there'll be things that we can learn from the experience of COVID that will benefit in the future.
I find that men don't ask the questions so much too. It's normally always the woman, the carer, be it a daughter, be it a wife. They're the ones that really draw the men into and find out all what's going on. So that's where the support groups really do work.
I think also, I would like to think that this study and the animation would encourage women to seek legal advice for compensation as well, because the one thing that came out of that I was surprised about, I did realise that less women sought advice, but I was really shocked at how low, what percentage that was of ladies that went on to seek legal advice, and whether they were successful or not. And I'd like to think that women would be encouraged to do that and understand that it's not a hugely onerous experience.
Yeah, that was an issue that I picked up on as well, Lynn, and issues about long-term care and impact on families and so on of needing long-term care. And I think, for us as a charity with our team of nurses, there are some key learning points that we can pick up on. And I think the issue about support groups, COVID's been a devastating experience, across the world. But I'm always one who seeks to find positive in those awful experiences. And I think that the way that we've managed support groups and done it virtually, there have been some people who said they would never, men more than women, men who said, I would never have gone to a support group, but I don't mind joining, from my laptop at home. So I think, we have to keep some of the, adaptations that we made, we have to keep them going, because it means we can get more people involved in support and so on. So I think definitely looking at the things that we learn about women, though, as Lynn has said, we can tailor our nursing support and our nursing interventions to meet the individual needs of people better now, because of what you found in the study.
I think your Meso UK's webinars have been a real godsend to people. They bring the information to the person. And we are patients. We aren't very well. So we're sitting. It's great to sit in front of your computer and have all this information come about trials and about care, even about breathing. It's just I just keep thinking it's a great tool to keep using.
I agree. And I think it's enabled some people to be really part of a community. #Mavis and Meso UK have done joint coffee mornings right across the country, and they've been really successful. And although we're now starting to see people face to face, and we have those face to face coffee mornings, we've still kept a hybrid approach. And that's something that we would never have considered before COVID. And it really has allowed some patients to seek the advice of the nurses that join us. And it's lovely for Mavis to be on there, because she's such an inspiration to other patients as well.
I've been all over the country. It's been brilliant. I join any meeting I can.
You're a genuine inspiration, though, Mavis. So many people talk about how uplifting it was to read about your story, because it's so terrifying when you're first diagnosed, and then they see the treatment that you've had and the brilliant response you've had, and it's just such an encouragement to them.
Thank you. It's an honour to do it. All the time I've got a voice, I will use it.
Fantastic. So now I'd like to go to a question we received from the public, a fantastic question actually, and it asked, did we consider the experiences of non-binary people in the research? And I've given the response to this question quite a lot of thought. And while we didn't have any non-binary participants, I think it really would have enriched our study findings actually. So it's a shame that we didn't. And I think even in like the 3 or 4 years since kind of the idea of the GEM study came about, there have been huge leaps in understanding of gender, which I think need to be incorporated into research more. And I think us as a research centre will definitely, going forward, make sure that our protocols and our recruitment material is more inclusive and very clearly inclusive. So I thought that was a brilliant question from a member of the public. Don't know if anybody else wants to add to that.
No, apart from to say, I think we've become a far more gender aware society. And I think, you know, in years to come, again, because currently, you know, the incidence of mesothelioma is pretty static, pretty stable. This is something that we're obviously going to have to consider. And I think you're absolutely right. You know, we hopefully will be repeating this study, or there'll be a spin-off. And who knows that in the future, that's something that we might be able to explore in more detail. But I absolutely agree with you, Steph.
No, I completely agree with Liz. We have had people that have gender reassigned that have sought our advice. And I think that's something that we can have a discussion with the Department for Works and Pensions, because all of the forms ask for us to put whether they're Mr., Mrs. There are no boxes to tick for people non-binary, and that's something moving forward that I think is going to be incredibly important.
Okay, thank you. So one final question for all of you. If you could provide one piece of information, advice or support for somebody living with mesothelioma, what would it be? I know it's a tricky question.
I would say to stay positive, seek advice, be it legal or a support group. Don't try and do it on your own, because you'll fail. You really need information all the time. And the more you can Zoom, the more you can go to conferences and learn about your disease, the better you'll be.
Thank you, Mavis.
Or should I say, an easier journey you'll have.
I guess I would echo that, Mavis. I'd say exactly the same to you. And I think it's easier for some people than others. And even if you are somebody who, you know, is less inclined to reach out in your hour of need, try and just break that habit of a lifetime, because there's a whole community of us out there, patients and legal professionals and support groups and researchers and clinicians. There's a whole community of us just doing everything we can to be there for you in your hour of need. But it's not easy for us to find you sometimes, so please reach out, because we're here for you.
There's, even today, there are still oncologists that say, go home and put your affairs in order. And I find men actually take that and they do go home and just sit there and put their affairs in order. They don't seek advice all the time. And it's those people that I like to stretch out to.
It's so important to seek advice from the lawyer's point of view. Make sure it's a specialist, but don't be frightened of the process. It's actually one of the most enjoyable things in my job is going and meeting people and listening to their life story. It's like having a chat. It's not like a scary interrogation in a courtroom or how you would imagine it would be. It's just such a pleasure to meet people. But the most important thing, I think, in this era of uncertainty about what treatment will be funded on the NHS in the future, is that taking legal advice can potentially open the door to bespoke medical treatment that you possibly couldn't access anywhere else. And it's really important to investigate that, I think, for your own peace of mind. And also it could be really life-changing for you.
Fantastic.
I think I'd just like to echo everything that everybody's said here already, but to just say that when somebody gets a mesothelioma diagnosis, the patient and their loved ones, they're not on their own. There's so many groups out there like HASAG, Mavis and I Foundation. There's Meso UK that they can get in touch with. There are so many people that can support them through their journey that they don't need to be on their own. And it may not be that they want to go to a support group. They may want some advice about benefits or compensation or something medical that's worrying them. but there's somebody always there to support them. And if they have the right literature in the pack when they're diagnosed, they know that that support is just a phone call away.
Fantastic. Thank you all so much. That was amazing advice. So on behalf of the Mesothelioma UK Research Centre, I just really want to thank you all for your time today. It's been absolutely amazing to get 4 experts in a room. I feel very privileged to have been able to spend this time with you and hear your thoughts. So that's really fantastic. So as well as you, I'd like to thank obviously our participants who really generously gave their time, their information, their experiences to help others. Everybody who took part, I was like, what are you doing here? You know, why aren't you going for a nice walk instead? They were like, no, we want to help others. So, you know, I must take my hat off to our participants, to our wonderful advisory board who helped us all the way through the study. And finally to the Festival of Social Sciences for hosting this event. You know, it's just another way of raising awareness, getting our findings out there and letting patients and their family members know that there's a huge, lovely support system waiting for them when they're ready to engage.